We spend our lives building for the future and laying the groundwork for an independent and full life. Our home is our sanctuary and the pulse of who we are. Never is this truer than as we become older adults. The best ideas for innovation in healthcare begin with empathy. Treat the whole person and allow us to remain in our homes with independence and peace of mind.
Going to an emergency room is quite traumatic for the older person and also for the family member who has to, get out of bed in the middle of the night and bring them there.
Our population is aging, and so are our needs. But the model for emergency care reimbursement hasn't adapted to support a change in care delivery.
So the Medicare program, when it was set up in the early 1960s, set up an ambulance benefit, and that benefit is ambulance services get paid if they transport. If they don't transport, they don't get paid. The whole system is incentivized to bring everybody to the hospital, to the emergency department, which is the most expensive place you can treat people.
In 2015, Huron Valley Ambulance began developing the Community Paramedic Program in response to requests by area hospital emergency departments.
The Community Paramedic Program is really a paradigm shift in how care is delivered. It allows the older adult to remain in their home, keep their independence, have a one-on-one conversation with a community paramedic in linkage with a physician. And in the meantime, it also is a benefit for the health system because it reduces cost of unnecessary emergency room trips.
My job satisfaction is very high. It's challenging. You wear about 10 different hats. This job is a little bit of paramedic, a little bit of nursing, and a little bit of social work.
I can think of a call I went on a few weeks ago where a lady had just been discharged. She got home, she sat down, she'd been in the hospital for quite a few weeks. She had all the paperwork in her lap and she was sobbing. And I know the nurse had gone over her discharge instructions with her, but she was tired, she hadn't eaten well, she needed to sleep, she couldn't figure out her medications, and she had called 911 to simply go back to the ER to have them solve it because she knew she needed help, and 911 was her option. She had never heard of us, she didn't know that we existed, and the crew called for one of the community paramedics to respond. And I was able to sit down, go over her paperwork, make 2 phone calls. We got it all sorted out, got her in her jammies, got her something to eat, and she was great. She was fine. She was so excited. And I didn't do that much, but what I did made a massive difference to her, massive.
HVA is working with area medical groups to enhance the program by integrating primary care physicians, evaluating and measuring cost savings, and presenting the case to payers that will bring financial stability.
We're doing lab tests in the home in which we get the results right away. We can order an x-ray that's really, really quick. We can do an EKG. And all in that with supervision by a physician in partnership with the patient and of course with the community paramedic to not only assess the situation, but then actually treat the patient right there in the home. The person gets a quick response into the home. They don't have to go to the hospital. The way we do things is centered around that older adult. And it winds up that over 2 out of 3 people that are being seen by the paramedic actually get to stay in their home instead of being transferred to the emergency room.
We are on the cusp of true change that will impact the quality of life for all of us as older adults and as caregivers.
Yeah, I look forward to the day in just a few years from now when the average older adult, when they have something they feel is urgent, that they know exactly where to call.
This innovation is a win-win for all. As older adults, we're able to stay in our homes. Caregivers don't have to rush to the ER, and everyone stays informed through technology, all at a cost savings for the patient and the healthcare industry.
The way we do things in Washington County is that we bring the care to you when you need it in a way that has both the physician involved and a really caring paramedic that's at your door, really trying to make a difference so that you can be safe and stay in the place you want to be.